Hi everyone. Now we are going to discuss about the biomedical waste management. Introduction. Biomedical waste management is an essential part of your hospital and healthcare services. Improper handling and disposal of medical waste can cause infections, environmental pollution, and health hazards to healthcare workers, patients, and the public. Next, we are going to discuss about the definition of biomedical waste. Biomedical waste is any waste generated during the diagnosis, treatment, or immunization of human beings or animals, or during research activities and the production or testing of biological materials. The next, we are going to discuss about the objectives of biomedical waste management. The main objectives is to prevent the spread of infection from the patients to the healthcare providers and to protect the healthcare workers, patients and the public, to reduce environmental pollution, to ensure safe collection, transport, treatment and disposal of waste, to comply with legal and regulatory requirements. The next we are going to discuss about the sources of biomedical waste management. The sources of biomedical waste management are hospitals, clinics and nursing homes, laboratories, blood banks, research centers, veterinary hospitals, mortuaries and autopsy centers. The next we are going to discuss about the types of biomedical waste. So the main types of biomedical waste are human anatomical waste, animal waste, microbiological and biotechnological waste, sharp waste which means needles, blades and scalpels, discarded medicines and cytotoxic drugs, solid waste which means dressings, cotton, bandages, plastic waste which contains IV sets, catheters, syringes and glasswares and metallic implants. Segregation or separation of biomedical waste according to the color coding. In yellow bag, we have to separate the human and anatomical waste, solid waste, expired medicine, and microbiological waste. The treatment of biomedical waste in yellow bag is incineration or deep burial. The next, red bag. In red bag, which contains contaminated recyclable plastics, IV tubes, catheters and syringe without needles, the treatment is autoclaving or microwaving followed by recycling. In white container, the waste such as sharps like needles, scalpels, surgical blades and sharp wastes in white containers. The treatment of white wastes is autoclaving or by dry heat sterilization followed by shredding. The next in blue container, the glasswares, broken glasses, metallic implants, ampules, vials are separated in blue container. The treatment of blue container is disinfection and recycling. The next we are going to discuss about the steps in biomedical waste management. The steps are segregation at a point of generation, collection in color coded containers, storage in a designed area, transportation using covered trolleys or vehicles, treatment by appropriate method, final disposable according to the regulations. While in biomedical waste management, the healthcare workers should wear the personal protective equipments like gloves, face mask, cap, and shoe cover, etc., to prevent the hospital acquired infections like HIV, HBV, etc. The next we are going to discuss about the role of healthcare workers. The role of healthcare workers are the healthcare workers must follow the waste segregation guidelines, use personal protective equipments like gloves, face mask, cap, shoe cover, apron, and etc. Report needle stick injuries immediately, ensure proper labeling and disposal of waste, participate in regular training programs. The next we are going to discuss about the advantages of proper biomedical waste management. The advantages are it prevents infection transmission, It protects the healthcare workers and patients. It reduces environmental pollution. It improves hospital hygiene and safety. It ensures compliance with legal requirements. Thank you.